that we need to have a strict reinforcement of COVID avoidance behavior, and we are seeing that that's not happening.
It's very worrisome that this Delta is plus mutation spreads much easier and that is much worse in its infection to the people who get infected.
Currently, there is no need to panic, but we cannot be complacent.
Hello everyone, you're watching News Epicenter with me, Marya, Shakil. As India battles the COVID pandemic, the second wave continues to dip as both the unlock and the vaccination drive expand. India has registered over 46,000 fresh COVID cases in the last 24 hours and 979 deaths. Daily recoveries continue to outnumber the daily new cases for the 46th consecutive day. The recovery rate has increased to 96.8%. Almost 27 crore citizens have received just the first dose of the vaccine, while over 5 crore have been fully vaccinated. The centralized vaccine drive has rebooted India's inoculation mission with an average of almost 40 lakh vaccine doses being administered every day. And now we have surpassed even the United States to administer the highest number of vaccines in the world, with over 32 crore doses in just 163 days. Amidst these positive signs, the ICMR has now come out with a study which indicates that a potential third wave is not likely to be as severe as the second wave and may come later than expected. Moreover, as per a mathematical modeling analysis, the emergence of a third wave could be substantially mitigated by the expansion of the vaccination drive. This comes amidst rising cases of the highly transmissible Delta plus variant. Over 50 cases have been reported, remember, so far, along with 4 deaths. But these signs were there at the end of the first wave. Many experts had said we had gained immunity as the number of Delta cases was small at that time. It then spread like wildfire over 2 months with nearly 2 crore infections, over 2.3 lakh deaths, a crippled medical infrastructure and a body blow to the economy from which we are still recovering. Even as cases are coming down and the unlock drive has kicked off, COVID protocols are being openly flouted across the country, threatening to undo the control we have achieved, because the COVID virus is constantly mutating, finding more ways to spread. As signs of the next wave looms large, where do we stand? Because it is tough to decode and pin down the accurate behavior of this virus. Can our current protocols tackle the Delta plus variant? Is our immunity shield strong post second wave? The 2 waves, I would say, and the vaccine? Is our medical infrastructure prepared for the next wave? Should we hit the brakes on the unlock drive? Can we say the second wave is really over? We have a power-packed panel today. I am being joined by Dr. Shahid Jamil, India's topmost virologist. Dr. Jaiprakash Mulyal is epidemiologist. Dr. Narinder Kumar Nehra is former Dean and National Chair of AIIMS. I'm going to begin with Dr. Jamil, and we'll be also joined by Dr. Arvinder Soin in just a bit. Dr. Shahid Jamil, the ICMR study says that a potential third wave is unlikely to be as severe as the second wave. What is the rationale behind it? Because the Delta plus is in fact forcing shutdowns world over. Sydney, for example, has been shut.
Well, Marya, I have not seen the ICMR study, but I broadly agree with it. Because, a third wave hitting a huge third wave really hasn't made much sense. A lot of people have been very alarmist. Whether a third wave will happen or whether it will be localized or state-specific outbreaks, that will peak at different times really remains to be seen. What will determine it is how much we follow COVID protocol, how much vaccination we do, and finally, whether a significantly more infectious variant of the virus emerges. I'm afraid that Delta Plus is unlikely to be a significantly more infectious variant compared to Delta. We have already dealt with Delta in the second wave, and so far the results, there actually is no data at this point whether Delta Plus is more infectious or is more lethal. All kinds of things are floating out in the media without any
Yes,
evidence.
Dr. Jamil,
Just too few cases.
in the absence of data, what makes you so sure that this is less dangerous and less infectious?
Well, I'm not saying that I'm sure about it, but the mutation that has happened in this is not a mutation that has been linked to increased lethality. It's not a mutation that has been linked to increased infectiousness. This mutation has been linked to evading certain therapeutic monoclonal antibodies. And this mutation has been found in the beta variant, which also evades pre-existing immunity a little better than the alpha and the delta variants. So yes, it's a matter of concern, but I think a lot of things are flowing out in the media without any evidence. So I'm just objecting to that. I'm not, of course, not sure that it won't happen.
Okay.
We have to be concerned. We have to be careful, but we also don't need to be alarmistic.
Okay. So you're saying don't be alarmist. And on that note, I'm going to bring in Dr. Mulyal. Dr. Mulyal, I appreciate you could give me time on the show this evening. The government says that there is no scientific data so far to establish that Delta Plus variant of coronavirus adversely impacts vaccine efficacy. What do you think should be the minimum dosage as far as India is concerned that should make us that confident that we are going in the right direction and this Delta Plus will not be really pushing us in that dark hole that we saw in the second wave?
To begin with, we have had a very, very strong second wave, which in comparison to the first wave were manifold more infectious. Now, the advantage of stepping up vaccination is primarily that it will reduce the mortality rate given infection. So it has to go on as quickly, as fast as possible. The other side is that I've repeatedly said a natural infection imparts quite a long-lasting immunity among those who got it. In India, a large number of our population have already been exposed to this virus. So that is a resource we have. Now, we are planning a national sero survey, and each state government, many state governments are planning sero survey. And if the density of infection is large enough, it will be very difficult to conceptualize a wave that is nationwide. So you see this combination. What has happened is we had to expose ourselves to a large wave, and large number of got infected, and unfortunately, a large number died. But the remaining fact is that that has created a large body of immunized people, so to speak.
Okay.
Add on the vaccine, and we should be in good shape. And I'm very optimistic that we are going to not to be challenged by a very bad wave from any new mutant. However, that doesn't give us an excuse to relax. We have seen that our defenses are weak. Systematically, we should start working on how to improve it. Prediction equations are nice, but we know a lot already about our weaknesses. I think we should act accordingly.
Okay. On that opening comment, I'll give the opening comments also to Dr. Mehra. Dr. Mehra, India has administered 32.26 crore of vaccine doses, overtaking US. While it is a milestone, certainly, could you tell us what is the minimum dose that must be administered throughout the country and how many should be totally vaccinated for us to push the inevitable third wave?
Well, Marya, we always keep saying that we need, for the herd immunity to develop, we need about 70% of the population should have immunity either through the vaccination or through the natural route. But I think 32 crores is a real landmark, as you said, and I think we have really done extremely well because the two vaccines that we have used so far are both manufactured in India. I just want to go back to the point that you made earlier, the ICMR study. It's a very interesting study. They've made a mathematical model because we have all gone through this very, very aggressive second wave. Everybody is now talking about the third wave. People like me, the immunology, hardcore immunologist doesn't believe that there will be a third wave unless we sort of change our behavior too badly. You remember that the second wave came because of the behavior change in the virus.
We were complacent. That's the reason why the second wave hit us the way it did. While we look at COVID fatigue and all that is very well, the fact is that the people have started venturing out. There is a degree of brazenness as well. People want to step out. But the larger question is scientific mathematic data. What are we in that space when we look at it? Can we continue to say that third wave is going to hit us somewhere in September? Is there some time frame?
Nobody can talk about the time frame. This study that has come out from ICMR, it actually indicates that it might take about 6 months more. And second thing it says is that the third wave, if at all it comes, it will be very minor. It will not be that aggressive as the second wave. This is also based on the experience that we have got from the last century. In the last century also, for the H1N1 or the Spanish flu as we used to call, the third wave was very minor. And here now we are in a situation in 6 months' time, if we can buy that much of time, we would be able to really vaccinate a lot of our population.
Okay.
And the vaccination does a good job in terms of thwarting the third wave.
Okay, let me bring Dr. Shahid Jamil. Dr. Shahid Jamil, the study, I'm going to quote a part of this study which says, for the wave to be as devastating, at least 30% of the population who has been infected earlier must entirely lose their immunity. Or an emerging variant of the virus must have a reproductive rate over 4.5. That is, each infected person should be spreading to at least 4 to 5 people. Then what do we know about this Delta Plus, sir?
Well, we know very little about Delta Plus at this point, simply because, the world over, there's possibly only about 400 to 500 sequences known out of about 2 million sequences that are in the database. We also, in India know very little. India, there is only about 50 or 51 cases out of about 45,000 that have been sequenced. So this, there is really no basis to say that this is more infectious. So we have to keep our guard up, that's all, and keep surveillance up. But it is unlikely that Delta Plus is going to be much more infectious than Delta, to which we have already been exposed in the second wave. Just like Delta, when it came, it was far more infectious than the original virus. So I don't really see that happening. And the modeling, at the end of the day, any model is based on the data that is available and the assumptions that model makes. I think models can be good guides, but models should not be taken, too seriously.
Okay.
That's my view of that.
Okay. Okay. Dr. Mully, I'll come in on this. This specific point about when is the third wave likely, and are we still in the second wave? Because I think the medical community is still divided, because if the Delta Plus variant has been found in the month of April, then why can't it be assumed that the second wave peak was because of Delta Plus?
I know everybody is fond of the word wave. As an epidemiologist, I find it difficult to understand. If you suppress the transmission of the virus by other means, you will find a waveform being created. Now, what has happened is during the second wave, when it started, we had a national average immunity of 24%. So a majority were vulnerable. But the second wave hit us so hard, much more infectious, a big proportion is infected. So it looks like in most areas of India, not all, there is a high level of immunity among people, maybe exceeding 75%. Because there are studies that are showing in certain pockets 80%, and 80% showed both adults and children have adequate immunity. So given that kind of bits of data we have, one is quite confident that it's unlikely there will be a nationwide wave. There may be outbreaks here and there because there may be large pockets of susceptible population still available. India is a complex country. So I'm not going to guess on any wave when it will come. What I'm going to ask you is, forget the wave, get prepared to improve our existing facilities. A virus attacking you is not the problem. It causes death, and that can be prevented by vaccination and improved facilities. I think we should not worry about waves. We should just go ahead and systematically vaccinate and improve our facilities.
While we look at the vaccination numbers, Dr. Shahid Jamil, between June 1st and June 27, about 10.8 crore doses were administered in India at a daily average of about 40 lakh doses a day. The pace of vaccination may not pick up significantly next month is what the estimate is. But when we look at the government, what government has said to the Apex Court, it has said that 135 crore vaccine doses would be available in the country during August to December 2021. When we look at this number, how important it is for us to make the distinction between those who have got one dose of vaccine to those who are completely vaccinated. Will the virus strike more those who are partially vaccinated to those who are completely vaccinated?
Well, you have a couple of different questions in there. So let me answer your last question first. What do we know about one dose versus two doses?
Yes.
When real world data against the Delta variant coming from UK as well as the CMC Velour study in India, although the CMC Velour study did not say which vaccine, but we are assuming that it is Covishield largely because 90% of people in India got Covishield. All this data says that one dose of Covishield protects roughly 70%, has a 70% effectiveness against severe disease and hospitalization. And two doses, this goes up to about 90%. And that is really the basis for why there has been distancing in the two doses. Now, as far as the vaccination rates in India are concerned, if you see the vaccination rates on average since the 21st of this month, 21st we delivered 86 lakh doses, 8.6 million doses. And the average since then is roughly 60 lakh doses, 6 million doses. Compared to an average of about 3 million doses for the month. So I think this is a significant increase.
Okay.
What 21st of June also demonstrated that we have a public health system that is able to take that surge in vaccinations. So if more vaccine supply is coming through, we will be able to deliver those vaccines, because really a vaccine in the arm is effective, a vaccine sitting in the freezer is not effective. So it's a complex problem, multiple problems, but I think all indications are that we are on the right track and moving towards vaccinating everyone who needs to get vaccinated. Of course, the unknown in this is we don't know how many people have been exposed, and that should be addressed very quickly by the sero survey, the fourth sero survey that ICMR has been planning, starting. They said it will start in June.
Okay.
I don't believe it has started
Yes,
yet,
while we
but
emphasize,
nevertheless,
yes, while we emphasize on vaccination, Dr. Mehra, and we look at these numbers, which are certainly looking very, very promising. What is the minimum population that must be vaccinated? I'm going to ask that again because this is a new variant that we are looking at, a variant which is forcing shutdown in other countries, but we are continuing to unlock.
Well, Marya, we have about 90 crore adults in India, more than 80 years of age. So we need about 180 crore jabs. And this is what the government has now planned, that by the year end, we will have that many jabs available definitely. Well, as many as we can. Now, my feeling is, my guess is that after the second wave, which came so very strongly, we might have already achieved herd immunity in several parts of India. Because, the sero survey also indicated over there that the sero positivity rate is really very high. Yesterday, the news came from Mumbai, where they've done in children.
Right.
More than half of the children have antibodies. So I think we seem to be in a very good shape. We are at the moment giving 60 lakh vaccinations a day. It should certainly increase. I mean, ideally, we should go up to 1 crore a day. And our feeling is by July end, when the vaccines will become available to us, or maybe early August, we will certainly reach that mark.
Yes.
And if we reach that mark, we are going to be in a good shape.
Yes, I'll give the opening and also the closing comments to Dr. Arvinder Soin. He was in the middle of a surgery. He has found time for the show. Dr. Soin, a month ago, we were told the third wave is inevitable. Thereafter, certain medical experts started giving timelines that it's going to strike us in the month of September. Now the ICMR study, and we have two experts, Dr. Mulyal and Dr. Shahid Jamil, both of them are of the opinion that the third wave may not be as virulent because there's no data to suggest so, and even Delta Plus, it may be a variant of concern, but whether it is more fatal cannot be proved either. So if India continues to increase the pace of vaccination, we will be in good shape.
Being the optimist I am, I will be on their side. And I think that the third wave will not be as severe as the second wave. And I've read the paper that you said that you'll be discussing, the ICMR paper, and I think it's a sensible model. They think that the third wave will peak around between November and Jan, which is probably the case, which is probably going to be the case. And they've talked about the various ways the third wave can come, and they have concluded that unless we go crazy after releasing lockdowns and we are completely indisciplined about COVID-appropriate behavior, and unless there is no vaccination, there is no way the third wave will be as severe as the second one. So let's look at it from the positive side. Of course, if we don't congregate and if we release the lockdowns slowly, and even when the lockdowns are partially released, we continue to be disciplined and observing COVID-appropriate behavior, and if we speed up the vaccination as it has over the past 2 weeks, and if we keep up the tempo and vaccinate like upwards of 80 lakh to 1 crore people every day for the next 3-4 months, then I think that the third wave will definitely be smaller. And the only way that it can be a bad one is if the R0 goes to more than 4.5 according to this ICMR model, and which will only happen if, one, the variant is so different that it is very transmissible, and two, if we help to transmit it. That means, again, by being irresponsible. And of course, 3 years if we don't vaccinate. So I think that the positive side is that the third wave is going to be smaller, but we can't really, I keep saying this, throw caution to the wind at all. And we have to be responsible and continue to vaccinate rapidly.
30 seconds to you as well now. While we look at the third wave, and yes, it's perhaps we are hoping that it will be less virulent. What about the children factor? It was discussed for a lot over the last few weeks that children will be the victims of the third wave. What do you have to say on that?
So, the way pandemic waves happen obviously the populations that have been not exposed to either infection or vaccination will get affected in the new waves. So that is really the younger population, especially children less than 18 who have no vaccination for them and have probably remained indoors because the schools and colleges have been shut. So they've not been really exposed to the infection. Now, so they are expected to be the ones who are going to be affected in the third wave. And the other population is, of course, the rural population. Now, the study from Mumbai, which says that the seroprevalence of antibodies or neutralizing antibodies among children is more than 50%, is pretty encouraging. And I think that if, unless the variant changes to another one where children can be affected and, you know, the virulence is higher of that particular variant, I think that even though children may be affected, the effect will be mild. They will not get severe or fatal disease, one hopes.
All right. Dr. Sohan, thank you so much for joining us. Dr. Shahid Jamil and Dr. Mulia, I appreciate your time. Dr. Mehra, thank you for joining us on News Epicenter. Of course, this is a discussion that is going to continue. It's an evolving science, as we have been discussing. There are reports that are coming in the public domain every now and then to discuss whether third wave is going to come and how soon will it be striking us, how serious will it be. We'll be continuing this discussion. Thanks so much for watching. I'll be seeing you tomorrow.